But in those days, people tolerated this foul-smelling sewage contamination in their lives. Very different than what we have now. We are very spoiled. But in 1954, John Snow was an anesthesiologist living in England in the middle of a cholera epidemic. Did some epidemiological studies, went and took records and said, wow, you know, here's a town here, and right across the street, there are people that have no cholera. And on one side of the street, there are people who are dying of cholera, and he isolated it to a well that people were drinking from. Nobody knew what cholera was from. So he went to the city council and said, I know what's causing cholera. It's this well. Nobody, did people believe him? Of course not. They didn't believe John Snow. This is not the John Snow, you know, of Game of Thrones. This is John Snow, much before Game of Thrones. This is John Snow, anesthesiologist in London, trying to plead his case that this well should be closed. They wouldn't allow him to close it. What do you think? He went one night and he lopped off the spigot handle, took it away. No one could use the well, and cholera ended in that town. You'd think that the city council then and the medical profession would say, John Snow, you solved the problem. He published a paper. He went to medical societies. I know what causes cholera, bad water. And did his own physicians believe him? No. For the next 10 years, John Snow's voice was unheard, even though he lobbied. Which is an example of the blindness of the establishment. Here he had an answer, but no one listened to him until 1866 when Parliament enacted the sewer. But they did it because Parliament smelled. So in this 100-year period, from 1817 to 1920, more than 1 million people died of cholera. In 1923, 500 million people died in Russia alone. 500 million. Compounding that was the Russian Bolshevik Revolution during that time. Political instability. In 1958, Mao Zedong was in power. He instituted the Great Leap Forward, 5 years of a new economic reform in China. Pig iron, collectivized, communalized all the people. Took people away and built water projects. Farms went unharvested. And 40 million people died in a period of 3 to 5 years under Mao Zedong. 45 million. More than Stalin's reign of 25 million dying in the gulags. More than any other despot in the history of the world. 45 million people died during the Great Leap Forward during China. And during this time, as you would expect, cholera ran rampant through the rural towns of China. Now, the sixth pandemic of cholera ended around 1923. And around this time, Europe, the United States, South America were developing sanitation processes that were eliminating the bad water. So by 1971, the cholera was shifting from the pandemics of Russia, Europe, the United States, and Asia to undeveloped countries, developing countries. And most of the cholera deaths are now occurring in Africa. And on that sheet that I gave you, you'll see a number of different epidemics that have occurred in Somalia. And I think Zimbabwe, Haiti, Yemen. And I want to discuss a couple of these with you. In 2010, Haiti suffered a major earthquake. Thousands of people died under poorly designed buildings. But it also had almost 1 million cases of cholera. Almost 10,000 deaths during that 1 year period. Where did cholera come from in Haiti? It had never had cholera before. Well, interestingly, cholera came from Nepalese military men who happened to bring cholera from Nepal under the United Nations, established a camp in Haiti where they, among other UN troops from Europe, Japan, were stationed to create order in Haiti. And they had a little camp on the hill, and they, like a military discipline group, dug latrines, had outhouses, and when they went to poop, somebody had cholera. Cholera ran down their latrine pits, got into the water supply, and spread through Haiti. Created a big political uproar because now the World Health Organization had brought cholera to Haiti. Another example of how political instability brings diseases and pestilence to the front is Yemen. Do you know about Yemen and the problems in the Middle East? So Yemen is now in the midst of a civil war. Saudi Arabia is on one side, is on the Sunni side. Iran is on the Shia side. They're fighting amongst each other, these Muslims. And Saudi Arabia goes in 2017 and bombs the electrical plants in Yemen. The electrical plants now are gone, and now the water treatment plants cannot work. So this wastewater cannot be treated, water purity declines, and cholera epidemic breaks out. So now the World Health Organization estimates that 1 to 4 million people a year will get cholera, and we've got about 100,000 deaths a year, which is the current 7th pandemic of the world. This is what I drank water from in Nepal for 4 months, a Eurogard. If I drank tap water, well water in Nepal, I'd get immediately sick. So this little apparatus there, attached to electricity, turns on an ultraviolet light and forces the water through an osmotic filter and purifies it. So there are ways of purifying water. But as you see from the outline, you will come and do some of your own research. You will understand that 10 to 20% of the world's population does not have access to clean water. And when you drink bad water, you get sick. Now, in the US, we incredibly use up to 120 gallons a day of fresh water. And most of that fresh water, so illogically, we use to throw our shit down the toilet. When the world, the majority of the world, is suffering from a potable, drinkable water shortage, we in the US are taking perfectly good water, which we can take out of our tap and drink, putting it into our toilets and contaminating it with stool. How ridiculous is that? So guys, the future of the world is going to be based on changing this concept. It has to. We cannot continue flushing our waste down into the sewer, further contaminating our rivers, our streams, our oceans, requiring huge expenditures of electricity to purify this water, adding to the global increase of carbon dioxide, to purify water which is already pure, to decontaminate with stuff we shouldn't have contaminated it with anyway. Totally illogical. So guys, this is where I hope some of you will take the lead and lead the world. Because attempts now are being made to change the handling of waste in not only developing countries, but developed countries as well. So the United States may take 150 gallons a day to take a bath, flush your stool down the toilet, flush your urine down the toilet. How ridiculous is that? I'm going to explain to you that, how silly that is in a while. We cook, we bathe, we water our lawn, we grow our crops. But in Germany, that usage is only 35 gallons a day. And the World Health Organization says that a person out in Afghanistan, in Nepal, can get along washing, bathing, cooking, drinking with only 5 gallons a day. I would challenge any of us to use 5 gallons a day of water as a total need. Very difficult. Now, in my world travels, I've used lots of toilets. And hopefully, you use a toilet, a squat toilet. Most of the world does this, by the way. Squat toilets, not water flushing toilets, but toilets like that on the left. They're clean. But I've been in places where the toilets have been real bad. And I've been in places where there have been no toilets. And I've had no alternative but to take a dump in the woods alongside of the road. And this is what the majority of people in the world do. And you'll see from your outline that this is the problem in a great portion of the world, that 20% of the world, 10 to 20% of the world, has to resort to open defecation. Now, to us, this seems so foreign. How many of you folks have been hiking, gone to the beach, and all, and taken a crap in the woods? How many have never taken a crap off a toilet? Come on, raise your hands. So, how many have never taken a dump in the woods? It looks like 3/4 of you. Oh my God, you need to learn something before you leave high school. So, the majority of people in the world will use toilets that are not always clean. It's estimated that maybe 40% of the people in the world do not have access to toilets. 40%. In Africa, this is a huge problem for girls. It prevents girls from going to school. Because if a school doesn't have a latrine to take a pee or take a dump, or to help them with their cleanliness during their menstrual periods, they don't go to school. Can you imagine not taking a pee for the entire 10 hours that you're at school? That's what girls are subject to, and that's why they don't go to school. And furthermore, when you're in a country where there are no toilet facilities that are secure and private, and you have to take a dump in the open defecation, not only do you contaminate the fields, you contaminate your water sources, but there's a health risk and a social risk to the women who have to go off in groups under a tree, usually reserved for the evenings as a group, or in the morning, they go out together, do their privates, because men will come around and rape them while they're taking a dump. Can you imagine that? That is the situation in most of the poor countries of the world. Talk about women's rights, voting rights in the U.S. This is not a significant issue. A bigger issue is your personal safety as a woman in a country such as India, where 50% of the population practices open defecation, where the majority of rural India, men and women, practice open defecation. Here's a woman taking a dump in the middle of a street in Afghanistan. Here in Bangladesh, an open canal, always used as a sewer. And I've seen this in the Philippines. My first trip to the Philippines in 1988, getting off the plane, driving through Manila, big city, going across a bridge, was this kid taking a squat by a river on a concrete ledge by his house, taking a dump. I didn't realize what he was doing. I thought he was waving to us in the bus. That was in 1988. That was 35 years ago. My first experience with open defecation. I thought that this was a problem in the world. When I went to Samoa just after my junior year in high school to work in a hospital, I was told, don't walk barefoot in Samoa, because in Samoa, people take a dump anywhere in the field. Western Samoa, not American Samoa. And there are these things called falewilas. Fale, house, wila, ocean, water. And they have a coconut tree knocked down from the beach out to the water. Tidal lagoon, so it's not waves. And a little house built there. And this is where people who lived on the beach would do their business. They'd walk out on this coconut tree, sit in the house there, squat. And of course, when you watch them, their stool would drop into the water on the beach. And the tide would wash it in. I said, how could people live like this? Did they not appreciate the unsanitary nature of the stool and their urine in the tidal areas? Well, it turned out that I was intimately involved in this because I went diving onto a reef. To get to the reef, we had to swim through water, which was this deep or so. Tidal pool, father wheelers all along the shore. And I got hepatitis A in Samoa after I got that year. From the contamination of the tidal pools caused by the way waste was handled in a relatively modern country. This is a picture. There's a city behind these guys, but their morning routine is for these guys in India to go and take a dump in the mudflats of the river, which, as the tide of the ocean, the river, rise and fall, will wash it away. 40% of the world's population do not have access to a toilet. And in other parts of the world, in Africa in particular, you see that black area in sub-Saharan Africa? Black in India, Southern Africa, Rhodesia, former English colony, no open defecation, modern sanitation practices. But look at this, most of Africa, most of South Asia, India, Burma, Cambodia, Laos, open defecation. Although the Philippines doesn't have black spots. I've been in the Philippines. I've seen open defecation everywhere. Indonesia, the rural countries of the South Pacific. Central Asia, Pakistan, Afghanistan. All these countries, it is standard practice. I'm sure this is probably the first time you've heard about this problem. Well, guys, this is why I'm here. I told you that I was hoping to open your eyes to something. It's not a pleasant thing. And some of you are going to take this seriously, and some of you are not. And I feel very strongly about this because of my profession. That's what I have been involved in trying to improve the health of people, both here in Hawaii, where I practiced for 30 years, and in the rest of the world. And to me, this is something that is worth dedicating a life to. And I would encourage those of you who have listened to me today, who have obviously had to get over a lot of discomfort in talking about something which is not easy to talk about or to confront. Well, that someday you will take it upon yourself to take this concept seriously and do something in the world. Now, the last thing I'm going to talk about is what many in the world, myself included, have come to see as a solution to this problem of open defecation, poor water quality, disease, and that is the use of composting toilets. In a nutshell, if I were to build a new house, all my toilets would be off-grid. They would be this, a composting toilet. Now, I confess, I take a pee every night out in my lawn. Isn't that ridiculous? Well, it turns out that urine is the perfect fertilizer. If you pee on your hand, there are no bacteria in it. Your urine is sterile. There's no reason to be squeamish, and I can tell you, my hands, my feet, my chest, my underwear have been contaminated over my career innumerable times by piss and shit of my patients, blood in the emergency room, in my office, in the hospital. I've been vomited on, I've been spat on, urinated on, and pooped on. It's taken the time for me to get over it, but I've gotten over it. But urine is sterile. There's nothing wrong with that. When it sits around for a while, it begins to stink because bacteria now feed off the nutrients in the urine, and the bacteria emit it over. But urine right out of your bladder is completely sterile, and it is good. It's full of nitrogen, phosphorus, potassium, which is just what plants need. So, composting toilets, take the urine, separate it from the stool, that's really important. Take the urine, and you can immediately pour it on food crops. No diseases. Isn't that amazing? How many of you knew that before you heard me talk? Really good. Now, the reason outhouses smell, the reason these porta potties smell, is that they add chemicals. And it's mixing urine, liquid, with stool. And that's the problem. Because when you mix feces, solid waste, with liquid, it now destroys the process of bacteria decomposing the stool. So in composting toilets, the concept is separate the urine. So it goes into a separate container under the toilet. And every day when that fills up, take it, you pour it on the grass, you pour it on your lettuce and vegetables, your carrot field, your potatoes, and it's great fertilizer. You do this in any country. The solid waste falls into a hole and into a basin where every day you give it a turn. You throw in some cellulose, organic fiber, wood chips, sawdust, leaves, peat moss, to start the process of natural bacterial decomposition. And by stirring it and aerating it with air, the bad bacteria are disposed of, and the good decomposing bacteria grow. You have a fan run by a photovoltaic bank, runs a little motor, draws air out of it, vents it outside of your house. And then there's no smell. I can guarantee you there's no smell because I've used composting toilets. I met my first composting toilet about 25 years ago in Kalalau Beach, where the DNLR put a 5-foot outhouse. I walked up, first time I'd seen it, to throw leaves in the hole after you've taken your dump. That's kind of weird. So outside there's a whole bunch of leaves. Threw the leaves down. There was no smell in that outhouse. A similar outhouse was present up in the campground above Mokulea. No smell. So I know that it works. And now, after a month or two of this aeration, you can have someone come in, take this out, let it sit for a month or so in this outside or bury it in, mix it with the soil, and then throw it onto your crops. It's recommended that you not put it on your food crops because feces can harbor viruses and other bacterial parasitic organisms